වෛද්‍ය පී.ජී. මහිපාල මැතිතුමාට මම ඉතාමත් ගෞරවයෙන් ආරාධනා කරනවා.
Thank you. Next, I cordially invite Dr. P.G. Mahipala, Secretary of Health, to address the audience. Over to you, sir.
அடுத்ததாக பார்வையாளர்களுக்கு உரையாற்ற சுகாதார செயலாளர்கள் டாக்டர் பி.ஜி. மஹிபாலவை அன்புடன் அழைக்கின்றோம்.
Good morning to everybody. The most respected Sri Lankan cricketer, Mr. Roshanna Mahanama, who is not only popular in Sri Lanka but globally as well, who is a known philanthropist now, particularly focusing on rural development. We are very grateful to have you here today. The Regional Director of Health Services, Colombo and Galle, and our Director of Anti-Leprosy Campaign, Dr. Nirupa, all the other distinguished participants, our media friends, ladies and gentlemen. It gives me great pleasure and honor to be here to say a few words about anti-leprosy work the ministry has undertaken jointly with ADT. And Mr. Raghunathan is with us, helping us in many endeavors Ministry of Health has undertaken. I would like to talk about leprosy in a context where the government of Sri Lanka and the Ministry of Health has taken many measures to ensure that many diseases are being eliminated from our soil. I would like to say the first and foremost, we were able to eliminate malaria in 2016 and got the certification from World Health Organization. And malaria campaign was started in 1911 in district of Kurunegala, and then of course work across the country. And after 30 years, Sri Lanka was the first country to eliminate malaria and got the WHO certification in 2016. Also, we were able to eliminate filariasis again in 2016. And 2019, Sri Lanka was able to declare elimination of measles. And of course, last case of polio was reported in 1993, and since 1994 no polio cases were reported, and we have gone for regional elimination in 2012. So this is the context that we have worked, and Sri Lanka has a strong primary health care system and a strong preventive health services. So therefore, I think we need to work together very strongly to ensure that leprosy also eliminated. Anti-leprosy campaign was started in 1954, and through social marketing program, it's a huge and massive social media program we have undertaken in 1990s, and we were able to declare the leprosy also eliminated status in 1996. But that elimination is not like malaria elimination. Malaria elimination means no cases, 0 cases. But leprosy, it's 1 in 10,000 population. So that means leprosy is still there, but we call it as elimination because transmission is much low and interrupted. But again, we start to see leprosy cases. Therefore, the ministry has revamped the entire program and now moving strongly to ensure that within short period of time that we are going to eliminate leprosy as well. I am very much thankful for all those who have involved in leprosy preventive activities. Leprosy as a disease is a chronic disease. An incubation period is such it may go up to not 3-4 years, even 10, 15, 20 years and even more. So therefore it's not easy that you reach the elimination status and ensure that no cases are being reported. So we need to follow up the population for quite long time for once we declared elimination. Leprosy, we have a strong treatment, promising treatment, and there are 2 kinds of leprosy, and one you need to take treatment for 6 months, the other one you have to take treatment for 1 year. And if you take the treatment continuously for 6 months and 1 year, you are free from leprosy. So very promising, strong medical intervention is there. Then of course we are much focusing on contact tracing. If we find one patient, all the contacts are being traced, and then of course we take the necessary measures. There are pockets in the country, it's not available or it's not notified across the country in an equal manner. There are some pockets, so we are really focusing on those pockets as well. And we are working very closely with the dermatologists, and each and every patient who diagnosed are being referred to dermatologists and they start treatment. And also there are certain other primary healthcare institutions where capacity has been built to diagnose and then of course refer and treat. So I'm sure that with those efforts, if you continue strongly, we might be able to bring the leprosy number of cases down and then moving forward for elimination. One of the messages I would like to give is that we should not have a discrimination. There should not be any stigma. If somebody is diagnosed as leprosy, taking 2 days treatment is enough. That person will not infect anybody else. Person will not infect anybody else. So there's no reason for us to have a stigma and discrimination. That's very important. It's another disease. It's a chronic disease. It's like any other disease. And other diseases, if somebody has influenza, we don't discriminate them. So leprosy also such a disease. TB is another disease where we start the treatment and infectivity goes down strongly. So this is a very important message we have to give across the message. Mama, වචන ස්වල්පයක්